In recognition of Healthcare Quality Week, Munroe Regional recognizes all of the men and women at the medical center who work tirelessly every day to make a difference and their commitment to improving the quality of healthcare in our community. They are putting the care back in healthcare.
My name is John Biddle, and I would like to talk to you today about quality. Quality is simply defined as a standard of excellence. It is the superiority, the refinement, or the inherent excellence in character that defines many of our physicians and healthcare providers here at Munroe Regional Medical Center. An independent Munroe Regional Medical Center is filled and will continue to be filled with scores of physicians and healthcare providers who practice medicine according to the principles outlined by Francis Peabody in 1925, and that is, the secret of care of the patient is in caring for the patient. A modern interpretation of this quote was given by the eminent bedside educator and cardiologist J. Willis Hurst, who said, "The caring physician does not overtreat or overtest his patients." This week we celebrate National Healthcare Quality Week, but at Munroe Regional Medical Center we practice high-quality medicine all year round.
Hi, my name is Yvonne McElroy. I work in radiology, and I believe that quality begins with being a role model and influencing peers to consistently take the opportunities to make a difference, a positive difference in a patient's life, our workplace, and the community on a daily basis.
Welcome to Quality Week. What quality means to me: a commitment to give the patient and family the cleanest atmosphere a hospital can provide, safety, appearance, confidence, and a friendly staff. To go above and beyond, all in which give security and trust to the patient and their families.
Here at Munroe, we all strive to deliver a high quality of care in all that we do. I've had the unique position over the past 4 months of, on 3 different occasions, being on the receiving end of this care with 3 different family members being hospitalized with serious diseases. The level of care, the coordination of care, and the true caring and compassion exhibited by the staff was not only consistent but impressive, and what I have always aimed for and anticipated my patients receiving when I admit them.
Hello, my name is Debbie Simpson. I work in the Food and Nutrition Department. We provide quality service to each and every one of our patients because their health is the most important thing.
One definition of quality is a degree of excellence, and that's something we at Munroe try to achieve at all times. I think people realize when they experience quality, they can sense it. But the tough question is, how do you achieve quality on a regular basis? I think it's through a combination of training, expertise, and experience. I look at my role as a physician as being a leader of a team of professionals that try to do everything in our power to achieve better health for our patients. What I do as a physician is obviously important, but I see it as being no more important than the jobs by nurses, physical therapists, pharmacists, and other professionals in this hospital that all work together to achieve a common goal.
My name is Tamika, and I work here at Munroe. I've been here for 2 years on the 5 Southwest unit. And I chose to work here, because I like taking care of patients. I mean, quality is just a natural thing for me. I just imagine each patient as my family.
My name is Vinny Zielinski and I work for the maintenance department. I've been working for Munroe for the last 6 years, going on 6.5 now. Yeah, I think quality at the hospital is one of the important aspects of, let's say, our core values. When you join them all together, we have like quality being number one, but you have to have all these values together. You have to have the integrity, the honesty, you have to have responsibility, because everything you do reflects back to the, like say, the dangers that would be elated onto, say, a customer or a patient. And so all the things that our job encompasses in maintenance, we have to think about all those things and make sure that what we're doing keeps other people safe as well as ourselves.
My name is John LaHue, and I have been a volunteer here at Munroe for over 13 years. And the question today is, what does quality mean to me? And I think from a volunteer standpoint, we have a unique opportunity to make an impact upon the patient and their family and their loved ones that's different from any other part of the hospital, because we are oftentimes the very first person that people see and frequently the last person that they see. And so I think the secret of doing a quality job for us is to do the job right the first time.
Hello, my name is Lone Lee Masters and I work in the laboratory in the microbiology department. And I've been back at Munroe for 2 years. I worked here for 3 years prior. I left for 2 years to work at another hospital in the area. And I worked there for 2 years and I decided that their core values didn't quite match mine. And even though my commute was 10 miles as opposed to 30 miles each way, I decided I better come back to Munroe when there was an opening. And because Munroe's more in alignment with my values and the quality that they offer to the patients in the area.
Hi, my name is Tom Carson. I'm manager of pastoral care at Munroe. I've had the privilege of being here for more than 15 years now. The best part of my job is working with the folks that I have the opportunity to work with. The great thing about Munroe is that it recognizes that a person that comes into the hospital isn't just here because they have physical needs, but there are other needs that go along with us. And for me, true quality is meeting every need that the patient has. So that means that the staff, whether we're talking about the nurses or the techs or somebody from PT or one of the ancillary staff, will always be looking at a patient not only for their physical needs, but to see what needs they might have psychologically or emotionally or spiritually. So it's always fantastic to recognize that we want to help the whole person. So for Munroe, it's not just about the diagnosis, it's about what's happening with the person so that we can meet needs to help that person heal in the best way that we can. I'm proud of the staff at Munroe because indeed, they show care and compassion, their respect for the patient and for the families, and their attempt to communicate with the family and the patient helps them to stay in touch and meet them emotionally and psychologically and spiritually as well. Munroe is a great place to be.